Hello, everyone. This is Mark Anthony with AI Edge Promotions, the place where we bring you the best of the best doctors and people that are focused on helping you not only with your health, but also, number one, the gut health. A lot of people don't like to talk about. But today we're going to be talking with Dr. Ken Oliver out of the neuroclinic.org. That's at the neuroclinic.org. And if you're looking for somebody that can actually not just help you, but also, and not just patch your pain, whatever you may be going through. I don't care if it's neuropathy. I don't care if you're looking for stem cell. This is the doctor. He does not stop. Every day he's training, he's helping, and I'm excited to talk about something that a lot of people don't talk about. Today, we're going to be talking about concussion. You know, you might have a concussion. Why should you check that out? Why should you continue to live in pain? There's so many people out there that have a concussion and they do not realize it. Thank you so much, Dr. Ken. I appreciate you for being here.
Mark, it is a pleasure. Thank you so much for inviting me. I love doing events like this and being able to attend and be a participant in a podcast like this is awesome. So I appreciate you. Thank you for the invite.
Hey, you're welcome. People like you make the world better because we have so many doctors out there that just want to throw a pill at something and say, hey, you're going to get better, but not realizing what that pill does.
Right.
What are the effects? And I have a big story behind that, but we're going to talk about you. Tell us about how you got into what you're doing now, and then we'll go from there to concussion.
Yeah, it's been a journey. I started chiropractic school after undergrad. I graduated from Brigham Young University here in Utah in 2000, a degree in exercise science. And then years down the road, after doing some service work for my church, I got back and I remember my mom asked me, she said, "What do you want to do with your life?" I'm kind of looking around. I'm like, I don't know. Like, I have this background in exercise science and I love the human body. It's like, do I want to be a massage therapist? Long story short, I ultimately chose chiropractic as a profession. But even then, going into chiropractic as a profession, didn't understand the profound impact that just chiropractic, generally speaking, has on the nervous system. And then with my attention turned to the nervous system, it just became my life's passion to learn as much as I can about the brain. And I realized within the field of chiropractic, just a lot like medicine, there are specialty fields. And so there's a legitimate professional niche in chiropractic that deals with the world of neurology. And as I got into that, it just opened a whole expansive experience of what I could potentially be doing in a clinical setting for people with concussions, vertigo, neuropathy, movement disorders, behavioral disorders, like children with ADD or dyslexia or autism or whatever it may be. And so it's been a wild ride. And what I tell people is I'm a doctor. I love people. I love working with people and serving people. The only thing I can't do because of my scope of practice is I don't prescribe medications and I don't do surgery. So if you want me to help you, I'm going to do everything I know how to do without using drugs and surgery, because oftentimes that's just not the answer. So
no, I love it. You kind of hit on something that I really like. And a lot of people don't realize is that so much is stemming from the brain with what's going on. Because we have this brain that I always call it, you got the walnut effect, and it has these lines, and these lines affect the way we function. And we start to realize that what happens is that it not only affects us, but we can rewire that brain. And let's talk a little bit about the concussion. I know you and I discussed a little bit about concussions on sports and stuff like that, but how about people that don't really know that they have a concussion? What would you say some of the attributes that you've seen that they may have a concussion?
Well, the first thing I'd like to get to on that point is if you're curious that you may have something going on and you want answers to figure out if you actually have a concussed brain, the diagnostic tests that we utilize in our office are considered the medical gold standard. And I'll talk about a couple of those first. Every time I have a patient, let's say they call in and they know they maybe have experienced a concussion, but they want to get tested. We have them come in the office and we run 3 major diagnostics, one of which is called saccadometry. So that's a really effective way to analyze frontal eye field function and fast eye movements. And that gives us a really good picture into how well that frontal lobe is working just by running an objective diagnostic test that gives us really clean information. Now that's super important because your frontal lobe is responsible for decision making and impulse control, focus, concentration, mood regulation, right? And we have devices that can actually objectively measure that stuff. And there's certain things that we look at within these testing parameters that tell us because of the research that's been done if a brain is concussed. And the only other thing I'll add is, so we also do computerized posturography or balance assessment. We do video nystagmography where we're looking at eye movements. And one new piece of equipment that we started using last year is from a company called Oculogica. It's called the EyeBox. And it's the first FDA-approved device that can definitively diagnose a concussion without using any other form of baseline. And it's a really cool, slick piece of equipment. So to your point and your question, what we can determine if you have had a head injury. And then you follow down the cascade of symptoms that are typically associated: light sensitivity, sound sensitivity, headaches, ringing in the ears, depression, fatigue. I mean, the list goes kind of on and on and on with people that are experiencing head injuries. So,
Oh, wow. So you guys have what kind of diagnostic system do you guys utilize? I'm just kind of curious, as in
it's those machines that we're actually using: saccadometry, computerized posturography, video nystagmography, and then the EyeBox assessment is, as it stands right now, until something else more impressive comes out, is the medical gold standard in analyzing brain injury and being able to identify and confidently tell a patient that they have a concussion or they're dealing with a post-concussive type symptoms.
Wow. So give us an example right now. And I love the examples that you did get. You're saying that, the sensitivity, a lot of headaches. And so let's just say you have someone that has a lot of those things, say headache, sensitivity, depression. Would you also, and I'm just throwing this out there because, and I'm not a doctor, so I get it. I'm asking questions. So these are things that I'm seeing out in this interesting world that we live in. How about people that just out of the blue just can't control anger or frustrations? Because I've seen that in my family. I've seen that in my family.
No, that's I'm glad you brought that up, because
where it's like, wow, it's like, where'd that come from? Like it's almost like a Tourette's. Again, I don't know the wording, so I'm just using layman terms.
Right. Well, I think what I could throw you over to, and most people are familiar with this story because this is kind of the classic story in neuroscience that speaks to the importance of neuroplasticity and the way that the brain actually functions, and how, like, to your point, what you said earlier, the nervous system controls every function in the human body. So it's connected to everything, right? So Phineas Gage is the name I'll throw out there. If you remember his story, he was an explosives expert back in a mining town. I forget exactly where he was from, and I think his skull is still in the Smithsonian. But something discharges inappropriately. The rod goes through his eye socket, pierces his frontal lobe, goes out his skull. He survives the whole incident. But what they found was that after his recovery, he became the town pariah because his frontal lobe was shot. Right. So when we run saccadometry and we see someone's brain that's just not working well up here in the front, this is where a lot of that anger or the impulsiveness or the irritability comes out. So when I get patients that come in, let's say it's like a husband, wife, and the husband's the one with the brain injury, I will always ask the spouse, tell me about mood and irritability. What are you seeing?
Wow.
Almost always to a T is like, yep, they're angry, they're irritable, they're quick to anger, their fuse is like this short, where it used to be a lot more patient, So something very common that we see absolutely is anger, impulsiveness, irritability, things like that with head injuries.
And the sad part is sometimes what's happening is you have two people that might have the same problem. You have a major problem. I have another question. So you were talking about the 4 cranial nerves, correct?
Well, so the diagnostic testing that we run, the cranial nerves are another thing that we're looking at, is the integrity or the overall health and function of the cranial. 1 and 2 are outside the central system in the brainstem, and then you basically get the rest of those 3 are all within the brainstem, and that's your autonomic system. So people that are developing like dysautonomia, for example, I don't know if you've met anybody with that type of condition, but again, very common as symptoms associated with post head injury or post concussion is people develop dysautonomia, where cranial nerves are heavily affected.
Wow. What would you say somebody that struggles with that, something before they see you, what are some of the things that they can start doing to start healing that, at least slowly? I know there's no magic pill. There are different things that you have to do, and there's different steps. So I already know that. But what's one of the first things that you think that, hey, this is a step in the right direction?
Yeah, there's a couple things that I would generically or generally throw out there and say, hey, for the most part, anyone can implement some of these exercises to essentially take certain parts of your brain to the gym and work them out a little bit. One of my favorite exercises I call slingshot saccades. And so this is where I'll have patients hold their thumbs up like this, and they orient their eyes and head towards one target, and then you turn your
Mhm.
head and then you look to the other target. And it's just an exchange back and forth from right to left that implements certain ocular
Right.
muscles that fire off certain nerve bundles. And that's a great exercise for your frontal lobe. So if you feel
Right.
like your patience is wearing thin, or you are irritable, or you're quick to anger, exercising the frontal lobe by utilizing fast eye movements is really effective. Another really awesome one that's super easy that people can do is gargling. When you gargle and you activate the muscles in the back of your throat, that stimulates vagal nerve tone, and your brain loves vagus nerve tone. And that helps with, heart function, gut function. Vagal nerve stimulation is what provides the gut motility and getting the movement around so that you're having normal bowel movements and you're not constipated, things like that. So those two, I would say, are kind of like my favorite, just general exercises that I would give to pretty much anyone: slingshots, saccades, and gargling.
Okay, awesome. So I have another question. Just I know that a lot of people ask this, and we already know why, but most of this stuff is not under insurance. Do you see that we're going to be moving more under insurance since we have, so we have Kennedy who's trying to get, he's been for stem cells, he's for
Yeah.
get the color out of our food. No, I feel like I'm seeing that there's a change, a shift going. Do you feel like that shift may even go into insurance of even helping other people out where you're able to see more people to help more people?
I'm very white pilled with, I mean, again, I'm not a major, like, I wouldn't say, without getting too political, like, I'm a fan
Mhm.
of a lot of things that are going on. Am I still critical and objective with looking at this, at the current situation? Absolutely. I love the direction that RFK is going, coming out and announcing to, trying pulling the food dyes out of food, doing things. I hope, and to a portion of me prays that there's some reform, because
I know.
I personally feel like the insurance model right now as it stands is completely busted. It's not
Broken.
healthcare. I refer to it as sick care. The insurance companies are out there to make whatever buck they can, and I feel there's something wrong with an insurance company that's supposed to be helping a patient, that's primary goal, at least in my opinion, is to make sure that person does not get assistance from the insurance company. It drives me absolutely crazy. And that's why a lot of folks within my world and my profession prefer to run a practice that's cash based. I mean, the only insurance we ever work with is personal injury. But I hope there's a massive reform with the way that insurance companies work, and introducing things like for example, this is a good example. I have transcranial magnetic stimulation, or TMS therapy, that I run in my office. It's a very,
Right.
very awesome tool that's used for depression and anxiety. In order for a patient of mine to even get pre-authorization to even be considered covered for TMS, they have to show that they've been prescribed two minimum, if not at least four medications that they've tried, your Xanax, your Prozac, your whatever it may be, before the insurance company will actually even authorize TMS as an approved
Wow.
therapy. And that makes no sense to me at all. So I hope there's some mechanism in play or something in the works that we're getting to, hey, let's go right for the solution to a lot of these problems instead of making people jump through hoops, and it's dysfunctional, completely dysfunctional.
Wow. It's interesting you say that. I actually agree with everything you said, even about the healthcare where we're at, because we live in a society. Example, say we'll just choose something, neuropathy, the doctor will send you home. Most of the doctors, I call them big box doctors,
Yeah.
send you home. Here's the pill. And then after that pill starts to wear off and it's not working as well, we're going to give you a higher dose. And
Right.
it's a higher dose to a higher dose to when you're dead. Instead of saying, I kind of feel like a lot of the truths isn't being told. Like, hey, you can reverse that. You can
Right.
reverse neuropathy. You don't have to live in that pain. You don't need to have a little, I call it a sticker on your arm,
Hmm.
But
Yeah.
I think a lot of that has to do with also not, we can't just focus on the healthcare. We've got to be people and use our brain, say, look, I got to get out of this matrix. There's a way,
Mhm.
there's a better way. But the problem that I'm seeing is that people know there's a better way, but it's the price.
Yeah.
It's my insurance is not going to cover it, but you know what I mean? So do you guys offer anything that, let's
We
say
do.
somebody wants to, but maybe like a care program, or where you can work with them slowly as they're paying? How does that work? And
Yeah, no, that's a great question. I'll try to make this as simple as possible. So When we run our initial examination, all the bells and whistles, all the neurological evaluation and stuff, it typically is a process that takes about 2 hours. You come do the testing, you meet with me. I have colleagues of mine that run a practice similar, and they'll charge upwards of $2,000 just for an initial exam to be run like that. I charge $290. I try my best to make things as affordable as possible, understanding that, not a lot of us are just walking around with wads of cash in our pockets and we can't afford stuff like this. So I try to be as affordable as possible. Just for an initial exam at $290, I feel like that's affordable.
That is affordable.
Yeah. And so just keeping that in mind, and I always, my patients sometimes will tell me that you need to raise your rates. And it's like, well, I don't want to. I'd rather help more people than not. And as long as I've got a roof over my head and food on the table, I'm good to go. But I'd say average case fees for like a full, let's say I see
How about blood work, everything we're talking about?
Blood work, rehab from start to finish. Concussion case, for example, might be up anywhere between 2,500 to 4,000. So even then, that's almost 2 full months worth of therapy and treatment for somebody.
Oh, that's all included.
That's all. I mean, and granted, that is a big price tag if someone's paying $4,000 for hoping that we're going to get some outcomes that we're shooting for, right? But I find that very affordable, compared to what's out there and what's available for folks to access in healthcare.
And then, of course, you guys are working with like hormones and stuff like that.
Yep. I run Dutch testing. If you've ever heard of Dutch, it's a specific company, but it's a dried urine sample that you send in. And so it's a Dutch exam. I love doing those hormone panels. Blood work. There's another company I use they're based out of Phoenix called Cyrix Laboratories. And if you're ever interested in, are the foods I'm eating causing inflammation or creating an immune response or just general autoimmunity, there's so many cool resources out there to look into all this stuff. It's great.
Wow. I love it. So if someone were wanting to get let's just say they're starting out with concussion. So number one, you would have to do the scan.
All the tests.
And then the next step for that would be
outlay a treatment protocol. So with this patient, am I seeing certain things on the video nystagmography? Like, for example, I'm going to have the patient track a target, and we have cameras that are watching their eyes and analyzing the movement. If they can't keep up with the target, and we're seeing what are called interruption saccades or anticipatory saccades, which is just a fancy way of saying your eyes just aren't tracking. I'm going to give that patient a gaze fixation exercise that maybe we call it a no-no, right? Where we stare at a target and we bring our head slowly back and forth, where we exercise that mechanism. That's really how neuroplasticity works. And what I tell most patients is, my job is to identify where the weakness is and then come up with a plan to get those weak things to become strong. And in that process, that's where you see the positive clinical outcomes along the way.
Okay. Wow. That's pretty awesome. So I kind of call it like this. You're basically an umbrella company. You kind of umbrella the whole body. It's not just, hey, okay, I'm just using as an example. We're not, okay, we should do chiropractic or we just do. And when did you move in more in that model of focusing more on the whole entire body than just, let's just say, chiropractic?
Well, yeah, that's a great question. And it's another thing that's kind of driven me crazy with just the way Western medicine works. It's very compartmentalized, and it's hard to treat someone holistically when you compartmentalize like that. And when it says on page 1, Gray's Anatomy, the nervous system controls every function in the human body. So that includes the cardiovascular system, it includes the digestive system, it includes everything, right?
Right.
So when I look at a patient, I can't compartmentalize, and just even in my world, I can't just say, okay, I'm going after this. I'm going to treat this person's brain injury. Well, what else did the brain injury cause? I mean, there's very good documentation that shows within 30 minutes to 60 minutes after a head injury, most people will undergo some degree of leaky gut. And now these folks are developing food allergies that they never had before. And it's because they hit their head, So again, you can't compartmentalize and look at just one thing. It's got to be the body and the human being as a whole.
Wow. I actually agree on that 100%. I noticed that when I started working for myself on my gut in certain areas, I started to notice that because I was getting migraines. Migraines that were so bad. Now I've probably had in the past, say, 16 months, I've had maybe one migraine, if that.
That's awesome.
But I used to get them like 3-4 times a month.
And that's one thing I think with your listeners, I'll just throw this in there and just add real quick, just recognizing that when you have gut issues, it doesn't just mean that you eat something and you feel gassy and bloated and maybe get a little diarrhea. it's not exclusive to the GI system. When you have gut problems, it can present as neuropathy, migraines, vertigo, all that. So that's awesome, Mark. That sounds like you got a good handle on.
It took a while. I mean, I've been working with you docs for a long time, so I pay attention, I listen, and then of course I work with other doctors because hanging out with them. But what I noticed though that I don't see a lot of people talk about, you can not only have leaky gut, but if your environment, very few people understand, if your environment is in a really bad, let's say you're with somebody that went through trauma and they're putting that upon you, and then what happens is the brain stresses, so it almost kind of squeezes, and those vessels, they start to cause problems because blood flow's got to flow, and if it's not flowing correctly, and I know that for myself, I was eating great. I mean, I was doing everything by the book. I wasn't doing no Taco Bell, which, that was my little sinful deal, But when I stopped doing that and then I pulled away from toxic people, see, people don't talk about that one, that could also trigger stuff in the body to where it starts to shut down, and then you're getting the migraines, and then all of a sudden your entire body starts to go down, But the gut health though is something that we hear so much about, but nobody wants to really dive in deep because they don't want to change their food. They don't want to change the way they eat.
Yeah. It's one of the hardest thing I ever ask patients to do. And that's like going back to that company I mentioned, full disclosure, I don't make a dime off of them. I just love their services. But Cyrex, Cyrex, Cyrex Laboratories based out of Phoenix, they can run these types of panels where they're analyzing. They can tell you, do you have small intestinal bacterial overgrowth, or do you have leaky gut? Are you sensitive to not just gluten, but all the 30 different markers associated with gluten that can contribute to something like a celiac disease. My favorite panel that they run is Array 10, which is the multiple food immune reactivity screen, where they take over 200 different foods. And it's so specific. They do even cooked versus uncooked. So you might be totally okay with raw broccoli, but if you cook it or steam it, you're in trouble because it creates an immune response. And all this stuff is just so fascinating. You can get so detailed with gut health, but I agree with you. People are terrified of doing this stuff because it means that they have to change, and change is a really hard thing for people to go through.
It's funny you say that, and it's funny, when you start to study your body, at least for myself, I noticed that. So example, if I start craving broccoli, I know there's something in that I need, that my body's saying, hey, you need what's inside that broccoli, or whatever it may be, say pineapple. We know that pineapple is great for the gut, so your body tells you. Now, your body also tells you, you've got two sides of the body. You got one side of the body that says, hey, go get the junk food, man. Go get the nachos at the 7-Eleven and go do a crackhead run. That's what I call it.
Right.
And then you do that and you're like, boom, I can't even move because your body's telling you it's bad. But what I've also noticed is that once you start to get in tune with your body like that, you are able to say, okay, if I eat this is what's going to happen. And if we start saying to ourselves, a good way to stop doing what we're doing, it's helped me, is if I eat this is what I'm going to feel.
Yeah.
Because we go by our emotions. And if I relate to something that this is how it made me feel, I'm going to stop doing it.
Right.
You know what I mean?
And to what you're talking about too, it is a vicious little cycle too, going back to what I was talking about with concussions. If I get someone with a brain injury and their frontal lobe is compromised or damaged in that brain injury, well, that makes what you were just talking about so much more difficult, because that is the part of the brain, they call it the executive brain, but that's the brain that helps you with impulse control and rational thought. So someone with a damaged frontal lobe has really hard time with those inhibitions, and making the right decisions. And a lot of that boils down to food as well. So that's why it's like that vicious cycle a little bit.
But what's a trip about what you just said, though, kind of backing up a little bit, and even going back to the brain, people just think, okay, a concussion is, okay, I hit my head. And that's not necessarily. There could create a concussion in the brain from trauma, like what you and I were kind of discussing. And one of the things I realized too, to see if you even have a gut problem, correct me if I'm wrong, like what you just said, make hard to make decisions, maybe fast to react, hard to make decisions. And when they make decisions, the decisions are wrong, mental fogness, stuff like that. But what I've learned, even with myself, is I no longer make quick decisions. And I used to see, the world tells you make quick decisions and do it. And when I started to slow down my brain, because a lot of our brains are going really quick because of the foods that we're eating, and it's just going crazy, And what I notice is that when you slow it down and you start thinking about things methodically, the brain's like, you know what, now I'm able to heal because it's so
Yeah.
used to just firing off. I'm going to go do this and do that. And
Right.
then what happens is you're kind of, I'm going to go back, I'm going to throw it out with the Bible, slow to anger, quick to listen.
Right.
That's totally opposite of what we're taught in society. It's, I'm
Right.
going to blow up real quick. I'm going to get pissed off. I'm going to
Right.
flap the handle. I'm going to get upset. What I've learned is, you know what? That's not who I am.
And to kind of what we were talking about before, before the show, the stress levels, the emotional trauma, the emotional abuse that
Yeah.
sometimes people go through after having an injury like a concussion is very detrimental to recovery, in the sense that if you even just think about it from a pathological standpoint or a physiological standpoint, someone that's under an inordinate amount of stress is going to be secreting abnormal amounts of cortisol, for example, from the adrenal glands. That's the stress hormone. Now, cortisol has a really unhealthy relationship with insulin. And if cortisol starts messing with insulin, then you're going to have issues with blood sugar control and all this other stuff. And so it's kind of to your point and what we were talking about before the show was, can there be a relationship between emotional stress, trauma, and things like that that present almost like a concussion would? My answer to that question would be absolutely yes. You need to mind what's going on in your environment and be able to slow things down and avoid the excitotoxic, contaminants that we have in our environment. There's a fantastic book that I love that was written by, he's a medical neurosurgeon named Russell Blaylock, and he wrote a book called Excitotoxins: The Taste That Kills. That's the title of the book. But I mean, again, it's all interconnected, even the emotional aspect of all of this.
Wow. I love this. And you know what, we're gonna actually land the plane. I actually want to continue. I know for a fact we're gonna have you on the show again. My brain's popping in a couple of areas that I can tell that there needs to be more on this, because it's not just about concussion. We've got
Right.
mental health, which is an all-time high right now, where people don't realize that the mental health is connected. Everything's connected to our second brain. And the second brain is the gut. And then number two, hey, let's see what's going on up here. You know what I mean?
But there's a reason why in a lot of the literature and the research that's coming out now, they're referring to, like, Alzheimer's disease, for example. They call it diabetes type 3. It's a gut disorder. It's a metabolic disease that starts in the periphery before it gets into the central nervous system. Yeah, I mean, there's things we could talk hours about, so many different.
And this needs to be out more, because we have Dr. Google, who I can't stand. We should just call him Dr. X, okay?
Yeah.
And we've got
Dr.
Google.
Corruption.
I know, they just Google it and they're like, oh yeah, this is what I have. I'm like, wow, I guess the 55 years of the schooling that the doctor went through didn't count, because you know what I mean? And so they go to Dr. Google, and then what happens is they're basically their own doctor. And the sad part about it is they're getting false information that's actually hurting them. And then they stay away from the truth.
Yeah, that's a tricky one, because on the other side of that coin is also the egomaniacal doctor who thinks that he can do no wrong, he or she, right?
Right.
So there is a push, pull, tug of war with that, of like depending too much on this technology and Dr. Google, but also being very wary of the doctors that you actually go see, because the last thing you want is to be sitting across the chair, in the room with the doctor that thinks they know everything and has all the answers. I'm one of the first to raise my hand and say, hey, guess what? I don't know everything, but I love learning. So if you ask me a question and I don't have an answer to it, I'm going to find one. I'll find an answer. But doctors being able to drop some ego and just be willing to love their patients and really, truly want their patients to get better, that's what healthcare truly needs.
Wow. I love where you went with that. Now, another scope on this before we move forward. Are you doing any teleseminar, or where you're helping people through like Zoom?
I'll do stuff like this. Unfortunately, a lot of what I do, it kind of requires hands-on, especially if has anything to do with the chiropractic aspect of this. I can't do that over telemedicine, but there's a number of folks that have come to see me in my clinic, actually from like out of state, and they come and do intensive therapies. So let's say my patient from Nebraska, or the one from British Columbia, or the one from South Carolina that's come to see me. If I want to do a follow-up and say, okay, I'm going to check in with you after about a month, and we can do something like this, like we're talking now, like over Zoom. I do that every once in a while, but I'd say it's a small percentage, and it's more following up with people and just checking in and seeing how they're doing. I could do blood work consults with folks too over telehealth conferences and stuff like that.
Yeah, just wondering because I know we're kind of everything's kind of going more telehealth where,
Yeah.
I
Yeah.
mean, I understand if they fly in and then of course you guys can kind of
Right.
talk and see what's going on and then they can make another appointment, stuff like that. But Dr. Ken, I want to say that it's been a blessing to have you here on the show. I love what you do. And we can, and everyone out there in internet land, you can find Dr. Ken Oliver over at the neuroclinic.org, the neuro short, sweet, and simple. And again, thank you so much for being here. And before we go, we know that all doctors aren't equal. Okay. Before somebody picks a doctor, what are some questions they should be asking a doctor that it could be profound to say this is a good doctor to maybe work with? Maybe some questions that people should be asking, because there should be an interview. People don't think about that. You should interview doctors to see if they match. If they're,
Right.
you know what I mean?
Right. Man, that
Because
is
people are just giving doctors nowadays, you know what I mean? And they just, okay,
right. Or yeah, or they check their insurance plan and they say, okay, who's in my network? And I just have to pick someone willy-nilly that's in my network. It's like it's okay doing that. I always like going on like stuff like healthgrades.com or on
right.
somebody's website or on, Google is what it is, and we don't
Yeah.
have to love it. But if you find someone that's got 5-star reviews out the wazoo and there's good testimonials and reputation already outstanding, that's one place you can start. Is work with your community too, ask around.
Right.
You're going to run into people that have gone through their own issues, and ask and say, hey, which doctor did you see? Where have you been? And that's a great place to start. But that's a great question. I don't know if I have a phenomenal answer for you, but it is so very important to be able to identify a doctor that's willing to work. And I think if you do find someone that willingly will raise their hand and say, listen, I'm working for you. You're the boss in this scenario. I want you to tell me everything that you're concerned about. And so one, I guess, short answer to your question, one would be a doctor that actually listens. Because I can't tell you how many people come in and they'll spend some time with us in the clinic and they'll say, this has been so refreshing.
Right.
You actually listen to me instead of me going I just had a patient in here that told me she's been to 2 endocrinologists and she feels like she's just being gaslit by these endocrinologists and they don't care about her. So if you can find a doctor that one will listen and one that you truly feel like they actually love you and they have good energy and excitement about getting people well, that's a good place to start.
Okay, awesome. And I'll throw a spin on it. We keep spinning. So, just because I've probably interviewed over 300 doctors, and one of the things that I'm kind of catching, if someone were to ask me, hey, Mark, what would you say to find a good doctor? I would always kind of say, okay, number one, are they working on the whole body?
Yeah.
And not just that, when you go to these doctors, they see you for 10, 15 minutes, get you out.
Right.
Is this a 10, 15 minute doctor, or is this doctor, ask a question like, so doctor, let's say I struggle with neuropathy. How long is this physical going to take? If you're going to, that kind of, I feel like for me, that kind of gives me a pulse. Okay, well, we're probably going to be doing about a 45 minute to an hour, an extension up and down on the entire body, not just a scan, but we're going to see what's going on, because you might say your issue is this is your issue, but it's really a here issue. And so that's one of the things for me when I'm just hearing people, I'd be like, find out if they're working on the whole body and how does that look like, and how long is that going to take? Is it going to be 15, 20 minutes? If it's going to be 15, 20 minutes, I don't want to go.
Right.
Because you know what I mean? I don't know. And then the reviews are huge. Video reviews, like real ones, none of these written stuff. When I see a video review of people saying, hey, from 1 to 10, my pain was with neuropathy, it was a 12. And now I'm seeing, we'll just say Dr. Pickle. And now I'm, from 1 to 10, that pain level is at a -3. You know what I mean? I don't know. It's just, I'm just throwing like little ideas out there. And I just, my heart's to make sure that people find the right fit of the doctor that they're looking for, but again, thank you so much for being here. This was fun. I have a funny feeling we're going to be doing it again.
Thanks for having me. I agree. I had a blast. Thank you for the invite and look forward to anything upcoming in the future.
All right, brother, God bless you and blessings upon your business. I'm praying blessings over your business because, God wants to help people.
Thank you. Appreciate it.
All right.